So let's look at the movement of water and electrolyte. When the body loses water, the plasma volume decreases. So remember, plasma is the liquid component, mainly water, in the vascular compartment, which makes up blood. As a result of the plasma volume decreasing, the concentration rises. When the body loses electrolytes, water is lost by osmosis. The regulatory mechanisms are different. Here we've got fluid gains and losses, the diagram showing you. On the left we've got the box, which is representing the plasma membrane, and it's the intercellular fluid. Then we've got the blue framed area with the arrows going in and out of it, and that is the extracellular fluid. So we have metabolic water, this make water as a result of the chemical reactions within the cell, contributes 300 mils in 24 hours to the body's extracellular fluid. We should be getting about 2,000 mils from water, which is absorbed from the digestive epithelium. It means that about 1,000 water will be lost in urine. Again, we've got water vapor, about 1,150 mils is lost in evaporation and respiration. Water is lost in feces by about 150 mils, and then water is secreted by sweat, and that's variable depending upon the temperature of the environment and the temperature of the individual. So we've got a water balance by daily input and daily output. You can see here that we get a source of water from food, consumed liquids, and metabolic water produced from catabolism, and that amounts to 2.5 litres. Then we have methods of elimination. So we've got urine elimination, evaporation through the skin, evaporation at the lungs, and loss in feces. And that too balances out at about 2.5 litres. So allocation of water losses. If the person is dehydrated by water depletion, this develops when water losses are greater than gain, which means that the person is unable to drink water. But the electron they are retained, then cellular fluid osmotic concentration rises, and water from the intracellular fluids to cellular fluids, and there is a net change in extracellular fluid, but it is severe water losses, and this could be through excessive perspiration if the has a very, very high fever, if they're unable to consume water, say if they have with their throat, so with a little child who may have, or adult who has mumps or tonsillitis and they're unable to consume water, then they severe water loss. Also, if a person has repeated vomiting, so this is repeated vomiting, unable to keep even a tablespoon of water down, and also through diarrhea. So you can see that food poisoning is a large to losses of severe water losses. The static responses, we have physiological mechanisms where antidiarrheal hormone and renin are secreted, and also behavioural changes where the person is looking to take in water, try to drink, but they may not be able to because their body is so out of balance or diseased. So this diagram shows you what happens if the extracellular volume changes. So in the top box you can see that the intracellular fluid and the extracellular fluid are in balance. The two solutions are isotonic. What happens then if you have a decrease in the extracellular fluid? So that means that water is lost and the electrolyte solution there are increased. So there is a higher concentration. So this would make this hypertonic in relation to the intracellular fluid. What happens then is that the intracellular fluid, the water from that, moves out of the cell membrane into the extra fluid volume to try and out. So there is a loss of intracellular here.